project, right, that ended World War II. Well, this is kind of a Manhattan project. It's not business as usual, and everybody's worried, everybody's upset about what's happening, so scientists are being mobilized from around the country, and this is where America shines, Bill. This is, why we've been investing all that money in the National Institutes of Health all these years. Now it's coming to fruition, all of these new drugs and new vaccines, and it's a real privilege to be part of it here in America.
I sense, in talking with some of the specialists like yourself during the week, is that with remdesivir, now that you've got some indications of progress on these trials, is that you can mix the cocktail now in a different way, much like perhaps you did with Ebola 3 years ago, right, Doctor?
Yeah, or even remember how, if you can remember back when HIV/AIDS first appeared. First we had AZT, that was the first drug. Then we made modifications. Then we made combinations. Then it didn't require just in-hospital treatment. We could give it as outpatient. Then, you could give pre-exposure prophylaxis. So this is part of an evolution. The world's going to look very different in a year from now when hopefully we have many new treatments and hopefully new vaccines. So there's a lot of cause for optimism.
Yeah, I know you're working on it, Baylor. We mentioned Gilead, Johnson & Johnson, Oxford University as well. This is a global effort. And I'm going to guess that even in your lifetime, you have not seen something like this. Yeah, you mentioned HIV and you mentioned Ebola. But when you think about all these countries that are wrapped up in this current virus, this is something that we have never seen before, Doctor. Last comment on that.
Right, and so, one of the things about our vaccine is it's a low-cost vaccine, a little lower technology in the sense that it's been around for a while and you can even make it locally. So we're hoping that ours will be especially useful for global health, because one of the things I'm worried about, some of these vaccines are pretty high-tech, and it may take a while to filter down to some of the low and middle-income countries. So we're trying to get some vaccines out there that'll work immediately and be useful in poorer countries in South America, Africa, and South Asia without sacrificing quality. So we're aspiring at Baylor and Texas Children, part of our mission to make the first global health vaccine. So we'll see how we proceed.
Good luck,
on that.
Doctor. Stay in touch with us on that, okay? And to the men and women in Baylor down in Texas, good luck, okay?
Thanks for all the
good stuff ahead. Yeah, you bet. Peter